welcome here. My talk, actually our chairman and co-chairman emphasized on the outcomes measurements, and they have forcibly did so even before my presentation. Way back in 1990, I think most of you are not born, I was trying to focus on the outcomes research. I was in touch with one of the FDA officer, he's I think associate director of FDA. I told him, sir, I'm looking for a Ph.D. project, quality of life measurements. And he said, Rao, either you're an idiot or a scholar. But that is 1990s. And I said, no, I don't want to be an idiot, sir, but I want to be a scholar. And he said, FDA didn't even start to measure these quality of life measures, even the cancer patients. What are your subjects? I told him my subjects would be hypertensive subjects. Way long you have to wait, Rao, to get your work recognition. In 1999, only the FDA released documents on the patient-reported outcomes, 9 years after. And India, it has not even taken off. It's good for me. But anyway, what I would try to do is, unless we back up the alternative medicine with the outcomes measures, we may not be a competitive in future. Let me start with a good quote. Happened was Dr. Helmut Sees receives the 7th Linus Pauling Institute Prize for his health research from Balls Fry. Here is Dr. Sees did a lot of work on stress. That is, actually, he is the one who used the word oxidative stress. And he has heavily contributed to the promotion of the natural therapies. And actually, a little bit of damage was done. I know it is out of the track, but 2 seconds I will take. Do you believe in magic, the sense and non-sense of alternative medicine? A book was written by Dr. Offit. Maybe the Sinus Pauling Institute came out with this is the book, which has done a lot of damage to our so-called traditional medicine or alternative medicine. And it has got a lot of impact worldwide. They keep tracking your vitamins, that is the LPI response to the Offit article. And that is the vitamin myth, why we think we need supplements. That is a number of interviews were given. But why I brought this up, the criticism are loaded because alternative medicine doesn't have a support of the outcomes measures. Okay? I think unless we equip ourselves with these outcome measures, solid data, we may not in a position to competitive stage in future. This is why you need outcomes, because it's the affordability that is important to improve, and because the healthcare costs are rising worldwide. It is in India is the top here, and in other countries. Healthcare allocations are always limited. To control the spiraling healthcare costs, healthcare allocations across the world are limited. To maximize the minimal resources spending, the questions asked, does the intervention work? And if so, does it better than the alternatives? That is a comparative clinical effectiveness momentum that is gaining in USA. How it works? Now, Florence Nightingale was the first, we can say the history dates back when she determined that death was the crude outcome measure, and wounds, infections kill more soldiers than bullets. As you know, she is a good statistician, according to me, because I am a pharmacoepidemiologist. She used to document the side effects of the drugs. and nursing administration are the two interventions she used. Next, followed by the Ernest Emery Codman, is a Boston-based pediatrician, orthopedic, and his health status patient was determined before, after the intervention, that is surgery. He followed the patients over a year, and each patient was given a card, and where operating surgeon used to document it. But he has faced the heavy criticism from his own colleagues. Almost, he was very heartbroken guy. People called him as an eccentric because he wanted to have a transparency in the outcomes measures of hospital. So this is the first scientist ever this Donovan model, where he started the structure measure, and he says the outpatient. In between, he has brought in the process controls. A lot of controls were there, but the model did not get appreciated by many scientists. Here is his picture. Outcomes, by and large, remain the ultimate validation of the effectiveness or quality of the medical care. That was his message to the world. This is one of the tools widely used to measure the quality of life of the patients. It has a physical and role physical, bodily pain, general health, mental health component. It is very widely used. It is known as a gold standard quality of life assessment scales. I know it is very difficult for me to justify the topic, and a lot of resource material I have brought it, and anyone is interested to have the tools or the resources for this, I will voluntarily share all my information what I have, because my entire 18 years stay as academician in USA, I used to teach the pharmacoepidemiology as well as pharmacoeconomics, another subject that is related to that. So in my research there or here continues to be the measurement of quality of life as a tool, as an outcome, is one of the outcome measures only. This is the echo model, which has different compartments, but it is basically, I can say, to keep the time, economic outcomes, holistic outcomes, and they are the clinical outcomes. And Dr. Mandal mentioned the clinical outcomes, and also it's time for us to go for economic outcomes as well. The drug may be producing the clinical outcomes, but it may be costly. So you have to measure the economic outcomes as well, that is cost-efficient ratio or cost-benefit analysis. Mostly cost-efficient ratios are adopted because natural units are incorporated into the cost-effectiveness ratio. This is the widely accepted echo model. Next, followed by, this is the healthy quality adjusted life years. You measure the quality of life, and you always plot it before intervention. Yeah, this is without intervention, and this is with the intervention. You find that is the intervention between death and also full recovery. The perfect health is 0. So the quality adjusted life years are another tool generally used in pharmacoeconomic models. DALY is daily adjusted life years, because this is the measure World Bank uses, World Health uses, because to determine the disease burden. Every disease, and these measures are released by the World Bank every year, annually. Now, I want to ask these fellows where to send this. India is free to download their opening channel anywhere if they want. Patient outcomes has clinician reported, physiological reported, caregiver reported, as well as the patient reported. But the patient reported outcomes are widely accepted because it is the patient who tells you how he is feeling after taking the intervention. It may be any tracker, maybe allopathic, maybe natural, or maybe herbal. He is the one. His words are the final. So that's a patient report outcomes documents. But I don't know, many of you may be knowing this. There is a newly added dimension for the health definition, World Health. There are petitions filed before World Health to include the spirituality. It means not only physical, mental, and social, but also spiritual domain to be included as overall health. So this is very advantageous for the traditional medicine, because traditional medicine, they are very close to the healing process, whole body you take into consideration. This is the, in fact, I have some questionnaires framed by the World Health Organization. I have done already a few projects. It's an additional domain. Spiritual domain is an added advantage. Who, QOL, and spirituality assessment scale, 136 items. It's a questionnaire. I have assessed in Washington, D.C., in the Howard University when I was working as assistant professor, and Cancer Clinic Hyderabad here, because the spiritual domain has become very important for the patient, especially cancer, when someone is very close to death. And now a question comes, when alternative medicine becomes medicine? My answer would be, when it is strongly supported by outcomes data, alternative can become a medicine. And I know you have to compete, cost, competitiveness, and comparability. Patient-reported outcomes are defined by FDA and also the ISPOR, International Society for Pharmaceutical Outcomes and Research. It is defined. It's an umbrella term that includes the outcome data reported directly by the patient. It's one source of data that may be used to describe a patient's condition and response to treatment. It includes outcomes as global impressions, functional status, well-being, symptoms, and health-related quality of life, satisfaction with the treatment, and treatment adherence, that is, compliance to treatment. Now, this is a FDA, I looked at this figure from the FDA document, which is available internet, www.fda.gov. It has framed the how to design patient-reported outcomes for your own disease or for your own specialty where you are interested to investigate. And it has different guidelines, different stages, how to come up with your own PRO, patient-reported outcomes instrument. Now, this is I'll come to it. Evidence-based medicine, as Dr. Mandal mentioned, as well as Dr. Khan mentioned. That's what we need, and for that you need outcomes data. Now, Economics Nobel Prize 2013 was awarded to the three economists, Feynman, Hansen, that efficient market hypothesis. And Robert Schiller is the irrational exuberance, is just opposite, behavioral economist. It's a divergent views are rewarded by the Nobel Committee. There are two opposite views, but three scientists were rewarded despite they have the divergent, conflicting opinions. Same case is the chemistry. Newtonian chemistry as well as the quantum physics and Newtonian physics were rewarded by the World Nobel Prize Committee. It means divergent views are respected by the Nobel Prize. When that happens in chemistry and also in economics, why not? Newtonian quantum physics together were awarded Nobel Prize. Market and behavioral scientists blessed with the Nobel Prize. When traditional medicine and alternative medicine fortified with the solid outcomes hard data, it becomes a medicine. Very soon it may bag a mixed Nobel Prize. Thank you. These are my details. I have the resource material as well as the wherever you want any information. I will give my email and also my website. Any questions?
Yes, I think thank you for your presentation. I believe the economic outcome is very important in the practice of medicine or whatever you look at, because whatever we do, we have to translate our activity into the economy, that we cannot be too superfluous, expenditure that no one can afford to. So affordability is very important in the practice of medicine.
And I think another momentum is going on in the US is the comparative clinical effectiveness research. Comparative clinical effectiveness research means the traditional medicine can compete with the mainstream medicine, provided you submit data. NIH promotes the research, comparative clinical effectiveness research programs internationally. So it is time for us to compete the mainstream with our proposals backed by economic data. Clinical data, economic data is very important because effectiveness ratios are obtained by, numerator is the dollar or the rupee or whatever the value of the currency, divided by the natural outcomes. That is the effectiveness ratios. So the incremental effectiveness ratios, if you calculate and appeal, and your proposal will be accepted. Your medicine, your proposals, that is the best source for us to apply for the international grants even. Because that is the mainstream, that is where the competition is going on.
We can take a few more questions from the audience. If anyone would like to ask questions. Yeah.
Good afternoon, sir. I just wanted to know that in these models which you were referring to, ECHO model and the QL comparisons, the results which we get, the outcomes, are they quantitative?
Yeah.
Quantitative, or how are they optimized?
The quantitative measurements, because you are taking the clinical measurements, whatever is there.
Yeah.
If it is a blood pressure, it is a systolic, diastolic measurements. And also, when you go for the holistic outcome, another component, you measure the quality of life measurements.
Yeah.
Quality of life measurements at different scales. For a disease, there are generally one model. Disease-based instruments are available internet everywhere, or even World Health has a lot of scales for disease. You can design your own quality of life scale based on your experience and based on the subjects, what are the responses. So that is one way when you get your quality of life scale, and one way you have the dollar or the rupees, whatever it is, you have the ratios. So they are very, very scientifically determined measures, outcome measures. Ultimate aim, as Dr. Khan and Mandal mentioned, it is the patient who decides. It's not the government. One patient brought into the picture, he has a lot of freedom. That may be a medicine from natural, herbal, or mainstream. It is he who decides the medicine. So this is the time for us to grab that opportunity and design patient-reported outcomes measures and support our whatever the molecule you are trying to promote.
Yes, thank you, sir.
Thank you.
Thanks a lot. Any more questions, please? That's it. Thanks a lot, sir.
Thank you so much, Dr. Rao. That was a really nice presentation. I kindly request Dr. Rao to please collect his certificate from our chair and co-chair. Kindly give them a big round of applause, please.